What is radiation therapy's role in localized DLBCL? Imagine a treatment that targets specific cancer cells to help keep the disease from coming back. That's where radiation therapy plays a role in managing localized diffuse large B-cell lymphoma. Diffuse large B-cell lymphoma is a common type of non-Hodgkin lymphoma that can sometimes be confined to a small area. When it is localized, meaning it is limited to one region or lymph node group, treatment options often include chemotherapy and sometimes radiation therapy. Historically, radiation therapy was the main treatment for localized lymphoma, but now it is usually combined with chemotherapy. Chemotherapy, especially the R-CHOP regimen, is the standard frontline treatment. After completing chemotherapy, radiation therapy is often used as a consolidation treatment. This means it is given to help eliminate any remaining cancer cells in the original tumor site, reducing the chance of the disease returning there. Radiation therapy is especially helpful if the tumor was large, known as bulky disease, which means the tumor is 7.5 centimeters or larger. It can also be used if the lymphoma only partially responded to chemotherapy, or if there are multiple risk factors for relapse. In these situations, radiation helps improve local control by targeting residual lymphoma cells directly at the original site. This can lead to longer periods without disease progression and may even improve overall survival in some patients. However, if a patient's lymphoma completely disappears after chemotherapy and there is no bulky disease, the added benefit of radiation therapy becomes less clear. Some studies show that in these cases, radiation may not significantly improve survival, but it remains an option for patients who cannot tolerate further systemic therapy or have symptoms that need relief. In more complex or relapsed cases, radiation therapy can also be part of salvage treatments. It may be used after second-line chemotherapy, before stem cell transplants, or to help control symptoms in specific areas. For example, it can be used to shrink or palliate painful or troublesome lesions. Deciding whether to include radiation therapy depends on many factors, such as how the tumor responded to initial treatment, what the PET scans show, and individual patient health. It is important to remember that treatment plans are personalized and should be discussed with a team of lymphoma specialists. In summary, radiation therapy in localized diffuse large B-cell lymphoma is mainly used after chemotherapy to improve local disease control, especially in cases with bulky tumors or partial responses. It can also serve roles in salvage therapy and symptom management. Always consult with healthcare professionals to determine the best approach based on your specific situation.